Good morning, ladies and gentlemen. Just wanted to share a seniors topic with you this morning. I'm not a doctor, but I'm a 87-year-old senior, and talk about gout a little bit. It's a problem I've had for a number of years. It's when you get a uric acid buildup in your blood, and it shows up in your joints and makes stiff joints. And in my case, I'm getting it in my big toe. I'm going to show you what happened with mine. This one here, the joint swells up here, very, very tender to touch. And what's happened? There's an acid in your blood called uric acid. And what happens when it gets too high? It crystallizes and it gets to be more like sugar in your joints. And what happens when it crystallizes? The little joints in your joint stuff gets sharp, and when you try to bend your toe, it can be in your toe, it can be in your wrist, it can be in your shoulder, any one of your fingers or whatever. And when that uric acid is too high, then you have to take a treatment for it. Now, I took the capsule for a number of years, and I'll just show you that one. This one's called indomethacin. That's the one pill, the capsule. And this is the one they normally give you when you get a gout attack. And there's a colchicine that goes with that one. I'll see if I can get one of those for you. Bear with me for a sec here. This is a little label. Allopurinol. And that's the treatment for the regular treatment every day that I'm taking. Now, colchicine is the other one you take. Colchicine is the one that goes with the green capsule. So you take the green capsule and one of these ones. One of them takes the swelling down, and the other one takes the soreness out of the joint. Those are prescribed for your doctor, by your doctor. Now what happens? You take when you get an attack, a gout attack, you go see the doctor, and they will do the blood test. So what you do is you ask your doctor to do the uric acid blood test. And that's done at the laboratory, and then they will tell you what you need to have. Now, mine, for a number of years, I was using the white capsule, the white pill, and the yellow and the green capsule, and that works until for about 10 years, and then all of a sudden you have to take indomethacin, and that's a pill that they prescribe on a daily basis. And mine, I'm taking the indomethacin. I'll just show you how that one goes. Now, so when you get the attack, you take the green capsule and the indomethacin. Now, when that gets far along, you'll find it doesn't work. Now you go and they start giving you the allopurinol, which is the 200 milligram one there I'm taking. So when you take the allopurinol, that brings that acid level down to a manageable level in your blood. So the point I'm at right now, I am taking allopurinol. I'm taking 2 400 milligram pills a day in my blister pack. And then when you get an attack, sometimes you get an attack as well, even though you're on the regular medication. The medication, the allopurinol, is supposed to balance that right out, so that the acid level is maintained properly, so you don't get the attacks. So that works just fine until I think your system gets used to it. And then you get to a point where you're saying, well, I'm taking all the pearl in my daily pill pack, but I'm getting attacks as well. So you go back and you've got to take the colchicine and the green capsule. So you take indomethacin and colchicine. And then you get to a point where you, even though you're taking the daily stuff, you're still getting attacks. And that's where I'm at now. So I've had my blood test and I'm going back to see the doctor. And the way I understand it is the colchicine and the indomethacin is to be taken when you have an attack. But the allopurinol is supposed to look after the system and keep that balance. So when they do the blood test, they find out whether the allopurinol is working for you or not. Now, allopurinol can go all the way up to 900 milligram tablets daily. They usually don't want to go that high because they're afraid of kidney stones and stuff like that. But mine's got to be readjusted, so I'm seeing the doctor tomorrow. So the two minor pills you take first off is to help with attacks. And then when you get to the point where the attack pills don't work anymore, then you wind up if you don't do some adjustment, you wind up taking them all the time. So then you wind up taking 3 pills. Where you're taking the allopurinol on a daily basis, plus you're taking indomethacin and a colchicine too. So you got 3 pills to do what 1 pill is supposed to do. So I'm not sure where you're at in your lifespan, but what happens with you hear about about gout being a rich man's disease. Well, it's not that true because people have attacks with gout. Some people are more prone than others, and I've had the problem for years, and I'm just at the end of trying to sort out what's the best way to live with it. And when it gets in your wrist, it hurts when you bend your wrist, and my shoulder the same way. And my dad used to get it in his wrist, and he couldn't even stand his sleeve of his shirt touching. It was painful. So it's something we have to keep under control. So I just wanted to share that information with you. Talk to your doctor if you're having any attacks. Have the doctor do a uric acid blood test. Talk about indomethacin and colchicine, or the prevention. Those are the treatment pills when you get an attack. And when they don't work anymore, then you got to talk to them about allopurinol. And then you get to a point where that don't work anymore, and then you got to see if you can have that boosted up, so you can have less attacks with the other one. So keep your gout attacks to a minimum, and keep your medications to a minimum as well. So I'm just sharing this information with you. I've had the experience of having gout since I was 40 years old. It started in my big toe and still there. And it gets very painful for walking. Interferes with your walking. And it gets in your wrist. If you play instruments like I do, it gets in your big joints and you can't bend your fingers. And also in your shoulders. You'll find it painful for moving your shoulders around. So something that we got to share. And if anybody out there has had any problems or any solutions that solve their problem, I would appreciate you sending me back some information. So have yourself a great day, and I'm not a doctor, but I'm a drug user, and I'm a patient or the doctors experiment with us and try to find out what the heck they can do to make our lives better by taking pills. So have yourself a great day. Bye-bye for now.